I got into EMS about 7 or 8 years ago when I became part of the Biospatial company and got to learn more about that community and bringing my background in signal processing and data analytics, which was what Biospatial was built to do, and becoming more involved in that community through national efforts of NASIMSO, NIMSIS, and really enjoying that part of our work. And through that industry and that community, you get to know the competitors as well. And so ImageTrend being a big competitor to Biospatial in the analytics space, I got to know people like Dan Vinorny and Joe Graw. And although we are competing vendors, there's a lot of opportunity for collaboration and still had a lot of respect for what other vendors like ImageTrend were doing in that space. We evolved as a company going from focusing just on syndromic surveillance to building out more things and capabilities that states and agencies needed out of their data, eventually creating repository services and patient registry services, and also becoming a little bit more competitive to what ImageTrend was doing in those spaces as well. But again, a lot of respect for ImageTrend and what they had done, and got to know the ImageTrend staff and community through that process. And when it came time for ImageTrend to look at expanding their analytic capabilities, it was really a build versus buy decision, and ImageTrend is leaning hard into intelligence, and the buy decision was made. And being a part of ImageTrend now after that acquisition has been a really pleasant surprise to me, because from the inside now I can see how passionate the staff are about serving this community, EMS, fire, hospital space. And it's great to see how we can build upon what advances both companies have made independently, and now that we have a combined team, I think we have a stronger offering to our community and our customers. So I've moved from being more technical over the years to being more customer facing and hearing from customers of what they need out of our products, applications, and services, and helping to realize that in a company. And now in my role as VP of Government Solutions, I get to continue building those relationships primarily with our state and federal partners, helping them to get more out of their data and the services that our combined ImageTrend and Biospatial companies would provide to them. So I'm excited about what we'll be able to do as a stronger intelligence-focused company for our state and federal customers going forward. The integration of Biospatial into ImageTrend comes with people, products, and services, and I'm excited about bringing the things that we've done as Biospatial into the great things that ImageTrend has done to give more to our state and federal partners. A great thing that Biospatial was able to do was take the data from many different states and share that data back to a group of states so that they can leverage that combined data source to better understand how to meet their initiatives or serve their customers. And that's true for federal entities as well. They need to look at data in a national way as opposed to just a local or an individual state way. Now that Biospatial is combined with ImageTrend, it's not only a combination of a team and of services and analytic capabilities, but it's also a combination of data. ImageTrend now covers the majority of the country in terms of repository services and data, and with that combined data source, we can do very compelling things in the areas of research and intelligence. It helps to build better data models, but it also gives us better insights into what we can do for our federal and state customers. Performance measures, benchmarking, syndromic surveillance for things like COVID-19, opioid overdoses. We're coming into the summer, heat-related illness. There's a lot of things that we can do at a national level so that we can see trends regionally, nationally, and otherwise. Syndromic surveillance has been a key part of what Biospatial has done from the very beginning. We started as a federal program to surveil for topics of interest, opioid overdose, looking for things that might be biosurveillance threats. So it is a natural part of what we have done, and it's very important, not just at the federal level, but through all of the whole healthcare chain of understanding when these things are occurring and to the extent that they're occurring. Syndromic surveillance is about detecting things in the data that we have. So when an EMS record is generated, there's things that a medic is going to document in their impressions, in the narrative, in the vital signs, and other things that they'll put in there that are about their patient encounter. And our analytics can take from that and say, this is really about COVID-19 or an opioid overdose. And then all of those things can be aggregated into trends and models of what's normal and what isn't. So you could say that in Horry County, South Carolina, which is a very touristy place, a lot of people come and go, and there's a baseline amount of drug overdoses that happen here. But then in the summer months, people come, they visit, they get into trouble, and you see spikes there. Having trends on these locations can allow federal, state, and locals to see what's coming and prepare for those things. It also, in an aggregated platform like what ImageTrend provides, can allow others to see what's going on in their neighboring counties and states, so that it's not just local to them, but what's coming. You know, drugs is another great example of, if I see overdoses down Highway 95 and it's coming south down there, it's going to come to me and I'm going to see those spikes soon. But that is just one case in the sense of overdose. There's a lot of other ways that we can surveil for trends that are of national and local importance. And syndromic surveillance is just one way to help folks plan, prepare, and react to these issues. We developed a case definition with the Department of Homeland Security in early 2020 to look at how can we detect COVID-19 cases in EMS data. EMS is often the tip of the spear when it comes to public health crises, and this is a great data set to surveil for that. So we had to first figure out, how are medics going to document this? And it was a case definition that evolved over 9 months of 2020, where there was some standardization on how medics were being told, hey, this is where the place and how we want you to document this information. But more importantly, they became more educated on how to identify. You know, very early on, we didn't know what it was looking like. It was a respiratory thing. How infectious was it? How did it spread? We had to evolve our case definitions based on how people were able to diagnose these things and then how they documented it. But through that process, our detection became more sensitive to detecting actual cases of COVID-19, as well as keeping all the other things out that might look like COVID-19 but weren't really. The nice thing about having all of that in place was that it became a canary in a coal mine, if you will, about COVID-19 in this very important data source, that we would be able to see COVID-19 spikes in counties days before they would actually see that in a confirmed data source like the local health department's sources. So this was a great source and was used by state and county health departments during the peak time of COVID to see the trends coming and being able to react to them before, you know, it had already happened. Syndromic surveillance is important for combating the opioid and general overdose crisis. It starts with a good case definition and working with epidemiologists and state subject matter experts to define how we're going to extract that from the data. It's been a widespread problem, unfortunately, for many years. And we have very good case definitions now that are very sensitive to identifying those suspected overdose cases, be it overdoses related to opioids, methamphetamines. Many different types of drugs have come, and unfortunately EMS interacts with many of these types of patients and then have to be educated on how to identify those in the field and then treat them appropriately. Also, unfortunately, overdose patients often are seen more than once. It's a hard cycle to break, and EMS has been involved in many different projects to try to not only combat the immediate overdose issue, but try to break that cycle and get folks into programs which will get them on a road to recovery. Another way that overdose data is being used through the ImageTrend and Biospatial platforms is moving that data to other partners like the HIDA ODMAP program. Many states participate in that. The ODMAP program leverages primarily EMS data, but also information from law enforcement to localize areas of spikes in overdose counts. And again, that helps public service organizations to respond to those areas of crises and maybe say we need more resources in this part of the city versus that other one. It also helps to plan for the resources like naloxone administration to make sure that the naloxone kits, the leave behind kits, or the agencies that are responding are well stocked to provide that medication to reverse these overdoses. Market intelligence, formerly known as Navigate, is a really exciting area of our business. It represents bringing EMS data into the hospital and showing the value that EMS brings to the broader healthcare community. Hospitals, specifically emergency departments, receive about 50% of their patient census by EMS in some way, either emergently or through an interfacility transfer, so it's a really important part of the patients that are being brought to them. And ImageTrend is able to provide more information and more analytics around this very important data source and patient source for them by helping them to understand why patients come to their doors, where are they coming from, what are their conditions. And that's really great for them to build relationships with their community. The patients that are coming to their doors want to know about the services and the outcomes that those hospitals may provide. They can build relationships with the EMS providers that are transporting those patients. And it's all about improving patient care. The things that we can do in a pre-hospital setting that lead to a better outcome in the hospital setting are important, and you use data and market intelligence to facilitate that. Market intelligence provides a lot of value to hospitals, and they can better understand their market share from a terms of emergency transports, again, understanding where those patients are coming from and how they can improve outcomes and how they're related not just to the patients that are coming to them, but to the overall community where patients are going that aren't just going to their doors, but to other hospitals as well. It also represents a way of better understanding their interfacility transfers and the relationships they have with their in-network hospitals and hospitals that might be outside of their network. Furthermore, we can provide value to them by helping them see operational and clinical performance in the pre-hospital setting. And again, it helps to build relationships with their EMS providers, and with the ultimate goal of improving the patient care, efficiencies of movement through the healthcare system, making sure that EMS trucks are not waiting in the doors and not available to take that next patient's call or that next interfacility transfer. So it's improvement of the system flow, but ultimately, again, improving patient outcomes and care. Being new to ImageTrend, I'm excited about what our combined companies can do. And in my new role as VP of Government Solutions, I'm leading up the Government Solutions team that is focused on serving our state and federal customers better than we ever have before. And we're looking forward to bringing our great team of analytic experts to create new analytic capabilities in our suite of ImageTrend products based on the feedback that we receive from our state and federal customers. Later this year, we also plan to start some national initiatives working with those state customers to identify the things that are mattering most to them and create new initiatives around that to make sure that we are responding in our products, making our products able to do the things we need to do to support those initiatives, but also work closely with our research team to create new research products like papers and conference presentations and posters to further advertise the great things that EMS is doing and furthering our community and our capabilities. I'm excited to be a part of ImageTrend because there's a lot of great things that we did as part of Biospatial, very focused on analytics, and we have a strong customer base that are excited about what we've done there, and now we can bring that into the ImageTrend product line. I've been working with a lot of folks in product and development on what the future holds for ImageTrend products and analytics. We've got exciting roadmap developments going forward, and so the things that people liked about Biospatial, they're going to love inside ImageTrend.